When you're a physio and your patient is seeing multiple providers for the same problem, it's a pickle. And as my adoring fans know, I'm not a fan of pickles. Most people will say communication is the answer. But have you ever tried calling a doctor or calling a doctor because you think they're wrong? That's a short conversation. There's more to this than communication. Usually I tell you to stay to the end and then I'll reveal the surprise. But the surprise here is that the patient has to choose one provider. Keep watching and I'll tell you how I got to that conclusion. 3 points on communication. First, talking to others is clearly the answer, but everyone is busy. They don't have time for your problems. They have their own problems. Two physios probably won't agree on things, so you can't expect people from different professions to agree either. 2, working together and helping each other is always a good idea. In theory. It doesn't often happen in real life. When it happens, it's great. You need one person in charge of the treatment plan. The other should follow that person's lead. Nobody wants to follow, everyone wants to lead. 3, you have to write things down. Your charting shows what you did and what happened to the patient. You're a professional. You need to protect yourself. That was my first book. There are 2 scenarios. When roles are clear, then it's easy. But when roles aren't clear, then the patient has to choose. Sometimes I'm wrong. Sometimes things are easy. In that case, you wouldn't be watching this video. Let's assume for a moment that you are still watching this video. This is the easy situation. One patient with 2 different problems, or the patient has one problem and is getting different treatments. For example, a patient getting physio for a shoulder problem, also seeing a chiropractor for low back pain. 2 different areas, 2 different treatments, no problem. The other scenario is one patient with one problem, but getting different treatments. For example, a patient seeing a physio, getting education and active exercises. That patient can also be seeing their physician for medication, imaging, injections. The patient can also see a chiropractor for adjustments and passive modalities. The patient can see a massage therapist. So the same patient, the same problem, but each profession has their role. Everyone is happy. When this all works, it's great. When the roles aren't so clear, it's not so easy. And I'm saying that the patient needs to choose one provider. In my previous example, everything was neat and tidy. Everyone had their role. Everyone stayed in their lane. But in real life, things aren't so easy. Sometimes a patient says, that guy said I had a herniated disc. Do I have a herniated disc? I may or may not agree with somebody else's diagnosis. My rule here is not to throw anybody under the bus. So don't say the other guy's diagnosis is wrong. Bring that patient's conversation back around to your physio plan. The patient has a functional loss. We're addressing it with patient goals and active exercises. Let the other professions do their thing. Sometimes patients don't tell you they're seeing somebody else. I've had this happen. This is like when a patient thinks seeing a chiro is so routine they don't need to tell anybody in physio about it. I've had some patients want to double dip. This is where they go to one clinic with one insurance and then they go to a different clinic with a different insurance. This always seems to be work-related for some reason. Sometimes the overlap between physio and the other guy is too close for comfort. Like a patient getting chiro for their neck and upper back and shoulder, and then trying to get physio for cervical radiculopathy in the same area. Or your patient is getting manual therapy for some problem, and you want to do manual therapy for that problem. If the treatment area isn't clearly defined or the roles aren't clearly identified, then the patient has to choose one provider. I've done this a couple of times where I have a patient choose where they want to get treatment. Explain your physio plan, document your plan. But if you and the patient can't agree on that plan, then there's no treatment. Put on your big boy pants. Be prepared to make the patient upset. Be prepared to explain yourself to your boss. Be prepared to justify your decision to your regulatory body. Remember, we said you need to have this all documented. So the bottom line, when the patient is seeing multiple providers for the same problem, talking usually goes nowhere. Sometimes it works out fine, but usually you need to get the patient to choose one provider and document everything. What do you think? Have you been able to talk through your patient problems? And have your patients surprised you 3 visits in? Let me know in the comments below. My 2 books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking.
Thank you for your support.
Check out a different video here or subscribe to stay connected. Thank you.